So hopefully everyone made it through Black Friday without too many bumps or bruises. I know it was a little touchy there for me for a second. This month we're going to have a little fun with our video update. We're going to involve some of you and hear some of your favorite EMS memories. We're going to get our annual holiday bloopers reel in, but before we do all that, Dr. Liz Robinson is going to talk to us about some toxidromes that you might encounter in the field. So I'm Dr. Peterson, those are the 3 things you need to know, and stay tuned because you're watching Regions EMS Update.
You've all been called for an overdose, which can be anything from, I took an extra Tylenol, to a full arrest. But what can we do to sort out the in-between patients? Let's talk about common toxidromes that you may encounter in the pre-hospital environment. Let's say you arrive on scene to an agitated patient, pacing around outside his apartment building. You're able to verbally de-escalate him, and on physical exam, you note that he is warm to the touch, sweaty, and has rotary nystagmus. Rotary nystagmus is quite a specific finding. In the pre-hospital setting, you will see this with PCP or after administration of ketamine. Now let's say that this agitated patient instead had no sweating, a dry mouth, and large pupils. Not too many things cause people to be hot and not sweat. You should be thinking about anticholinergic syndrome. What common drugs have anticholinergic properties? Think antihistamines, such as Benadryl and hydroxyzine, Parkinson medications, and tricyclic antidepressants. A classic anticholinergic patient will appear to be trying to pick invisible objects out of the air. In later stages of toxicity, these patients can progress to seizures, coma, and death. These patients benefit from benzodiazepines, fluids, and a good EKG interpretation. If their EKG shows QRS prolongation or arrhythmias, bicarbonate should be added. If they have a prolonged QT, add magnesium. Say your agitated patient instead is warm to the touch, sweating, and has normal-sized pupils. Additionally, you find that he is on several psychiatric medications. You note that he has a bit of a tremor. Do you remember how to check for clonus? You probably learned in medic school, but it's likely not in your standard practice. The easiest way to check for clonus is to take a relaxed ankle or elbow and rapidly flex and release. More than 5 beats of clonus is concerning for serotonin syndrome in an altered patient or known psychiatric medication overdose. The mainstay of treatment for serotonergic patients in the pre-hospital environment is to manage their agitation, preferring benzodiazepines such as Versed over antipsychotics, IV fluids, and avoiding further serotonergic agents such as fentanyl. Lastly, let's move to patients with depressed levels of consciousness. Unfortunately, opiate overdoses have become so common that many police departments are deploying Narcan prior to EMS arrival. This may be great for the patient, but remember, the first treatment for apnea is a bag valve mask ventilation, then Narcan. Additionally, in PEA arrests, even when suspected opiate overdoses, we have now updated our protocol to exclude the use of Narcan. Why is that? Because Narcan reverses the sedation effect of opiates and can wake up a patient with a heartbeat, but will not reverse cardiac standstill in arrest. In fact, if you do achieve return of spontaneous circulation, the opiate sedation will likely be beneficial, and administered Narcan may limit your ability to sedate with fentanyl. So let's review. PCP causes waxing and waning agitation and sedation, as well as rotary nystagmus. Anticholinergics cause hot, dry, hallucinating patients. You will see clonus with significant serotonin overdoses. Narcan is no longer necessary in a PEA arrest. And when in doubt, call poison control at 1-800-222-1222.
So today I'll be spending my time driving around to several stations to hear what some of you have to say about your favorite memories and some of the most unusual things that you've seen in your EMS careers. I think this will be interesting. Check this out. What do you enjoy most about being in EMS?
The fact that every day is not the same. It brings different challenges every time you come on shift.
It gives us a unique opportunity to really make a difference with people.
Now, how about the real answer?
Yeah, that is the real answer.
Probably the schedule. Here at Lakeview, we work 24s. So on any given month, I'm only working 8 days a week. So that allows me a lot of time to spend with my family and do other hobbies.
8 days a week, huh?
Yep, that's what they say.
That's a busy schedule.
Yeah, it's rough.
8 days a week.
8 days a month.
There you go.
Just helping people. I went through it myself when our house burnt down, so I knew what that side felt like, and then being able to go into it and help those other people do the same that was done for us.
I like the change of pace. 1 minute you can be sitting down, the next minute you're out running the door. Edit that.
What's your favorite holiday memory being a part of public safety?
The parties at Station 14.
When you have to be at the station for a holiday, I think we do a good job in fire and EMS of kind of doing it as a family.
I think several years ago we were involved with bringing gifts to a needy family in the community. We delivered them on the fire trucks.
Probably just sitting down and eating dinner with everybody when we can, and the camaraderie you can build.
Doing like the bell ring for the Salvation Army.
Probably a couple Thanksgivings ago, I went to a car accident where a woman was driving and a turkey ran across the road and went through her windshield on her way to Thanksgiving dinner.
So, you know what she brought to dinner then?
Leftovers, yeah.
We light up this truck here and we drive around with Santa Claus and see all the kids come out running to the fire truck.
So, what is the most interesting thing you've ever seen in EMS?
For it to be truly interesting, I cannot say it legally.
I think we're going to get a lot of that today.
In the holiday season or in general?
Anywhere.
No comment.
It's wildly inappropriate to say on camera.
Oh, run we had across the street, but out there he'd tell you what it was.
I got nothing on that one. Getting called to a man down, having it being a giant 4-foot stuffed moose.
Check. Is this on? Is this on? I think so. Line on the set. Action in the background. Sorry. All right. Okay, we rolling? All right, that was easy. Getting them out of a cold, windy environment and increasing the ambient temp. Oh, so good. Ah! That'll be a blooper. Wait for background action.
Pause for the winter.
January, the month that repeatedly brings, the month that has recorded the coldest temperature in the, getting close. So sit back, switch your pagers to vibrate, kick your feet up. Because you're watching Regions EMS Update. Boy. Some of my finest work happens late at night when I'm writing scripts. I'm just making this up as I go.
Fine, I'm just smiling.
Some recent research. Sean Connery here. Ow! So I'm pretty sure we're all familiar with the, start over, sorry guys. This is how these go. Many of us have had experience, sorry guys. Hi, I'm Dr. Bjorn Peterson with Regions EMS. Here we go again.
Hey, we don't do that here.
What do you mean?
Ketamine!
So this month, get that, there we go. Outside in the summer in the upper Midwest can be, I'm just having trouble today. Okay. This is what I get for working too much. And very timely for those of you attending Regions CMS EME this quarter. That makes sense. Hey, you coming to EME this quarter? No obscene gestures in the background that time? What's that?
I said, are you on?
Yes, we are. We're starting here. That's okay. I don't know where the camera is. I don't see your hand. By overwhelming the hemoglobin with more oxygen molecules. hemoglobin. For the next one, I'll say, be thankful this month, and then you say, eat lots of turkey. I'll do the fire thing, and then you say the indigestion one.
Perfect.
Okay?
Perfect. Okay.
All right.
It's more of a ratchet. It's more of a ratchet activity. Okay.
All right.
All right.
That would be the bloopers.
Do me a favor, get the other one flat there.
Believe it or not, it's been over a year and a half since we've started doing these monthly update videos. We really appreciate the feedback you've given us, and we've tried to incorporate some of your ideas into the topics that we've been presenting. For those of you who have some time off this holiday season, enjoy it, take care of yourselves, spend time with your families, and for those of you who are working, thank you for all you do, and as always, be smart, be safe, and be professional. We'll see you next year. Thanks for watching.